their homes, and they have to utilize survival sets or ways to like utilize their bodies for safe housing, which helps fuel the epidemic. So I think like, yes, we could talk about like with these like biomedical prevention and these support and how we get access to treatment and prevention, but we also have to talk about like how poverty and how it's going to be systemic issues like homelessness and a housing crisis we're experiencing not only in New York City, but across this country. It's helping to fuel this epidemic as well. So it's ensuring that we have compassionate drug policy, ensuring that we have a way to help ensure that folks have access to stable and affordable housing. That also helps ensure that we can get to U equals U, right? It's very difficult for folks to be adherent to even their PrEP medication or even their HIV medication if they are transient in their housing, if they cannot afford their rent. I know a lot of like even Black gay men who I know who are on PrEP, they're stably housed, and honestly, they're not having that much sex, right? The folks that I know who are having a lot of sex, like they are unstably housed, and they don't have access to PrEP, and it's mostly rooted in not of their care for self, but actually like I don't have any housing to actually focus on like how to prioritize my health or even to manage something like my HIV treatment and or these biomedical prevention strategies. So I think like, you know, we have to think about HIV as a way it's always been approached. It's like it's a social justice issue first and foremost, that then has these public health implications to us all. And like that's what ACT UP started. It's like, hey, you're ignoring us because we're queer, right? Because we're gay. And that's why this epidemic continues to proliferate, right? I think when we
and isn't that the story of HIV/AIDS? I mean, it's social marginalization, right? Contributing to lethal medical harms. So
and political harm.
Absolutely. Yeah, exactly. But now what we're seeing is all the different vectors, all of them political, right? Which allow that harm to happen. So you can expect me to be vocal about that.
And just to add, I mean, I'm on a tangent, but like just to add, like you know, Peter and his in ACT UP back 30 years ago worked really hard to ensure that like my generation does not have to deal with this crisis nor experience the loss. In Louisville, Kentucky, I've known folks who have died of HIV under the age of 30. I lost a partner at 26-year-old in Atlanta. Like this epidemic is killing like young people in the South particularly, and it's young people who look like myself and other like young people of color, and it's just like there's been so much work, people have already died for this to ensure that my generation does not have to deal with this, and we still are. And it's from a place of like, there's no visibility and there isn't as much attention to it as well. So like, I think that's something that we need to like really address, that like folks really put in a lot of fight for this not to exist, and it continues to exist within my community.
And then if you think about 5,000 new infections around the globe every day, and about 1 million HIV deaths around the world every day that are again anchored in East and Southern Africa, but not only. So South Africa, the biggest burden of mortality, but also doing incredible work rolling out high impact programs that build on this U equals U principle. Pulling the rug out from under these programs when they're showing life-saving results and delivering more government commitment from those governments, reducing stigma, transforming people's lives in some of the very same ways that Jason describes. It's criminal that these programs are being flat funded and that these communities are having to decide, okay, does the nurse get enough medicine to treat people who are faced with diabetes in South Africa, or people who are facing HIV or tuberculosis, the leading killer of people with HIV in South Africa and around the world. That's
getting that look like I'm taking too long. Okay.
Do you know that look? So the good news is something can be done about it, but the issue is something has to be done about it. And I guess we're curious about what the next step is for this campaign and when we can expect to hear from you guys.
Yeah, so I think we want to do the next turn. We want to make sure we're consulting with people who are most closely involved in these things before we come out kind of guns blazing.
One of the first campaigns to meet with exactly.
That's good to hear.
Yeah.
So, you know, we'll figure out, we're kind of developing our next season of kind of rollouts in terms of what we're doing policy-wise and how we inject that into the conversation. There are a couple things I still want to make sure we understand some of the kind of dimensions of the math around before we lay out something comprehensive on this. Although, you know, it's not hard for me tomorrow to be talking when the topic comes up about why we need to expand funding for PEPFAR, why we shouldn't be flatlining our global work, why we need a public health approach or an evidence-based approach, let's say, on things like prevention of transmission through drug use, why we need the kind of access that we do to care, why we need to recognize that those who are people of color, trans women, people in the South are more vulnerable than a lot of the people for whom people think the AIDS issue is sort of solved in the United States. That much is something you'll already be seeing in our vocabulary, but in terms of being able to make contributions to the debate around next steps, both in terms of the global agenda and then in terms of what we're doing domestically, that's where we want to remain in touch with you, make sure we have the most informed possible kind of base of facts, policy, and numbers to put out.